Talking about depression is one of the most difficult things to do because there's a lot that goes into a diagnosis of depression. Depression as well as PTSD is likely. Depression as well as psychosis is likely. And depression without any of those things, PTSD, a history of trauma, family trauma, is also likely. What separates the individual who has a unstable and dysfunctional family unit is the fact that all of those different environmental factors, siblings, extended family members, poor relationships in the family, maybe there's been physical, sexual, and emotional abuse, maybe the parent was an alcoholic or struggled with substance abuse, whatever was going on in your environment, that impacts whether you feel depressed or not. It also impacts the longevity of your depression, right? So how long that lasts, and it also impacts the intensity of your depression. So in today's video, I want to talk a little bit about depression in terms of two things. One is having family trauma, and two is struggling with PTSD. I have found in my work over the past 14 years that if somebody has post-traumatic stress disorder, or if somebody has a traumatic family household, more than likely, they are struggling with their mood. They are struggling with depression. And let me just say that depression is exhibited very differently in females than it is in males. Research suggests that females tend to be the emotional criers who, really have a hard time just not crying, and they're kind of fussy and whiny and, difficult to kind of soothe. Men, however, are not like that. They're more irritable, they're more reactive, they're more impulsive, careless, there may be a lack of motivation. But before we jump in, let me briefly introduce myself in case you are new. My name is Tamara. I'm internationally and board certified as a trauma therapist. I'm licensed in mental health. I specialize in treating children, teens, and families, as well as adults who are dealing with trauma. Let's go ahead and jump in. I promise you that this is not my normal voice. I have been struggling with laryngitis for about 2 weeks now, but I just wanted to ask for your forgiveness of how my voice sounds in this video. I'm going to try to get my point across to you with this frog in my throat, if you will. Depression has many different faces, and as I stated at the beginning, a female that has depression can look very differently from a male that has depression. A child who has depression can look really different from the adults who may have depression. Depression does not show up in a person's life the same. Sometimes depression also can follow a diagnosis of something else. So let's say, for example, you have post-traumatic stress disorder. You can go through all those symptoms, flashbacks, reactivity to triggers, avoidance of triggers, nightmares, night terrors, just feeling really hypervigilant and constantly looking over your shoulder to see if anybody is attacking you or coming after you. You can experience all of those things, right? And then somehow down the line, boom, depression hits you. And depression also comes in many different forms. It's not just gender differences, right? There are differences in race. There is also differences in age groups. And there's also differences in terms of what kind of depression you're dealing with. So let me just say that depression can be mild, it can be moderate, it can be severe, and it can also be recurrent. Depression can also be seasonal, right? Seasonal affective disorder. Depression can also be situational, meaning that you're not a depressed person, but if the situation presents itself to you, then you more than likely are going to feel depressed. For a lot of people who are dealing with unhealthy, dysfunctional families and post-traumatic stress disorder, it's really common for depression to occur. Let me go through a couple of symptoms of depression for you, and then I'm going to highlight how depression impacts your healing with PTSD and family trauma. All right. So the first symptom of depression that a lot of therapists really look at, because it's very telling, is a lack of motivation and anhedonia. If you have lost that spark for life, and that spark for life is just gone, you don't feel excited, right, to do anything in life. You're not finding pleasure in those things that you once did. Some people have a loss of sexual desire or pleasure. Some people have a loss of pleasure in eating certain foods. Other people have a loss of pleasure, in doing typical things like going to the park, walking the dog, exercising, you know what I mean? So a lot of people struggle who have depression with low motivation and anhedonia. The other thing that I want you to kind of keep in mind here with depression is sleep imbalances. So you can have insomnia, meaning that you're not sleeping very well, right? You don't go to sleep on time. You're not tired. You may even feel charged up as opposed to tired. And then you may also have, an inability to stay asleep for long periods of time. So you're going to have sleep disturbance. The other thing is appetite disturbance. Now, thinking of this in terms of eating disorders, some people do trail off into the world of anorexia and bulimia, but most people just have a really inconsistent eating pattern, and that is often the sign of depression. Let's also not forget that depression can include psychosis, right? So there's a diagnosis that most providers tend to apply to situations where there's really complicated symptoms. Let me see if I have, I think I have paper in here. And I'm going to write something out for you just so that you can understand exactly where I'm coming from. So I don't even know if can I go this far? Probably not. Probably not. So I'm going to write this up for you, okay, just so that you can see what this looks like. Now, if you go to a psychotherapist and you're looking for a diagnosis and you're not quite sure what's going on because maybe you're hearing and seeing things that aren't really there. Maybe you have these firm beliefs that can't be proven, but it's interfering with your functionality. Maybe you're having delusions, which are false beliefs that are held to be true despite clear evidence, right? There's no evidence, you can't prove it, but you truly, truly believe it. And that belief has interfered with the functionality and normalcy of your life. So let's say that is you. Well, if you came into my office, I would diagnose you with major depressive disorder, okay? And depending on the intensity of your depression, I'm going to diagnose a particular category that's going to help other providers understand where you are, okay? So let's say you're having delusions. Maybe you're hearing and seeing things that aren't there. Maybe you're having a really hard time sleeping, right? You've developed an eating disorder, and now you believe that you are being captivated by aliens, or something is coming after you every time you lay down to go to sleep. So if that were happening more times than not throughout the week, then I would say major depressive disorder, because there's poor appetite, there's low motivation, there's tearfulness, there's irritability, there's inconsistent sleeping patterns, all of that, right? So I would diagnose you with major depressive disorder, and I would make it moderate, okay? And I would say with psychotic features, okay? And this right here is how it would look, okay? Major depressive disorder, moderate with psychotic features, okay? Now, here's another example. Let's say, for example, you feel great during the summer. You're happy, you're carefree, you are loving, you are compatible with other people, you click with other people, you love summer, right? There's nothing that's going to depress you in the summer. Fall hits, right? There's back to school, there's back to work, there's back to structure, there's back to rules and regulations, right? It's not summertime anymore where you get to alter your schedule maybe and leave work a little earlier, or go on vacation and take a few days off. That's all gone, right? So let's say that's happening. Now you're starting to cry. You're starting to feel overwhelmed. You're starting to feel needy. You're lacking motivation. You don't want to go outside. You don't like sunlight. You want to pull the shades down, right? All of those things are signs of depression. So where would I put you? Can you guys guess where I would put you? Here's where I would put you. Okay? Oh my God, if I could only write faster, right? Okay? This is where I would put you, right here. Seasonal affective disorder, right? And there would obviously be more criteria, right, that I would need to make the diagnosis. But I would say, yeah, she or he has a seasonal affective disorder, and that is why there's mood shifts when winter comes. And let me just highlight that some people feel terrible in the winter and feel fantastic in the summer, but there are also some people who feel really bad in the summer and great in the fall and winter. So it varies by person. But this would be symptoms of depression: low motivation, anhedonia, which is lack of pleasure in things once enjoyed, poor or inconsistent sleep patterns, poor and inconsistent eating patterns, possibly a developing eating disorder. There's something also like negative symptoms, and that would be like flat affect. Affect really describes what your face is looking like, and people who are depressed don't have that cheerful, bright, awakened look. They look really downcasted and really sad and really depressed, right? So I would be looking for that as well. How do they present themselves to the world, right? Sometimes for men with depression, there's anger and irritability. There's impulsivity and reactivity. There may be an increase in domestic violence because of their attitudes and disposition. There may be more arrests outside while they are doing things in the public. There may be police that get involved, right? Because most men that struggle with depression, they tend to be more reactive, more irritable. So they're likely to also come in contact with the law. They're likely to get in fights sometimes, right? So it really just depends on you as the individual. So then how does post-traumatic stress disorder and family trauma impact this? Let's get into that. All right, so the first thing that I share with clients who come to see me for PTSD or family trauma and they are feeling depressed, the first thing I try to get them to understand is that people with depression tend to have more traumatic experiences. Now, research suggests that this could be because most people who have post-traumatic stress disorder or family trauma also find themselves experiencing depression during the healing period, during the after effects of the trauma. Some research also suggests that some people with depression tend to have more traumatic experiences. So if you're depressed and your self-esteem is low, maybe you're going to get into a relationship with someone that's not healthy, and maybe domestic violence will occur. Maybe some kind of control tactics are going to occur, and maybe you fell into the hands of the wrong person, a narcissist, a sociopath, right? Let's say, for example, for you, maybe you're depressed, and the traumatic situation that you're dealing with now is a separation of you and your family. That is traumatic, right? So depressed individuals tend to have more traumatic experiences. That is documented in research. Keep in mind as well that if you have post-traumatic stress disorder or family trauma and depression, your brain is on alert at all times. Your brain is on complete high alert at all times. And here's what I mean by that. If you have family trauma or post-traumatic stress disorder, your brain has learned that it needs to be hypervigilant, that fight or flight mode needs to be on all of the time. Can you imagine how worn out the body is? Kind of think of the body as, a vehicle. It's a car, It looks good on the outside maybe, and it seems to be functioning okay, but when you pop open that hood, you've got wheels turning over here. You've got wires and bands stretching and going all kind of ways, right? Sometimes you can listen and hear some ticking in the engine. That is depression. So let's say, for example, you appear okay on the outside, but on the inside, it's not working too well, right? So if you have a brain that's on high alert at all times, and you're depressed, that's a double whammy, right? That's a chaotic scene. And so keep in mind that if you are depressed, your mind, your brain may also be on high alert. And that is not abnormal for an individual who has PTSD or family trauma. Keep in mind that if you're depressed, you may see the world in black and white, right? Black and white. Yes or no. There's no maybe. There's no but what if, right? It's just yes or no, right? There's no in between. There's no gray in between. And so when you see the world in black and white and you leave the gray out, right, then everything feels hopeless because you're not leaving any space for a positive resolution. You're not leaving any space for something to change or for you to change, right? So most brains who are depressed and who have trauma see things in black and white. The goal is to get out of that because you don't want to limit your world. Keep in mind that with depression and PTSD combined, psychosis is likely. Post-traumatic stress disorder, depression, and sometimes psychosis or schizophrenia, they work on the same parts of the brain. So sometimes they can trigger each other, and that can interfere with your life moving forward. Self-efficacy, the ability to see yourself as possibly doing well in life, and self-esteem is likely to be low in both conditions, right? Depression and PTSD both can impact, your self-esteem and your feelings of self-efficacy, your feelings that you can rely on you, that you are reliable, that you are talented, that you are smart, right? So self-esteem and feelings of self-efficacy are both down with depression. Family trauma and PTSD can add to that and make it worse. Keep in mind that the brain is a wonderful, complex, inherently complex organ. And so it's not always easy to say, you know what, I'm depressed and I think it's my dopamine, my serotonin chemicals, my norepinephrine, and my acetylcholine chemicals in my brain, right? All I need to do is take some medicine and the chemicals will go right back up. I wish it were that simple, but it isn't, right? Depression is complicated, and throw on top of depression, PTSD or family trauma, right? That's not going to be easy to figure out. So the brain is so inherently complex that you can't just reduce it to brain chemicals. There are other things like environmental factors, right? Where you work, how your colleagues treat you, whether you take the bus or you drive home, how much traffic you're in every day, how your relationship with your mom or your father is, what your relationship with extended family is. There's so many different environmental factors influencing depression and PTSD that it makes it hard for any professional to just say, you know, take this medicine so those chemicals can get back to normal, right? Yes, that's important, but it's important within its place. And so if you have PTSD or family trauma and you have depression all at the same time, then you need a multiple approach to treatment, right? These are things that I think we're going to talk about more as we go along, but I think it's important to keep in mind depression, PTSD, and family trauma combined can all feel overwhelming to you, but it can also be overwhelming to the provider who may be trying to treat you. It's a really complex relationship, and so we have to understand how both conditions, depression and PTSD, impact you. Thank you so much for being with me today in this video, guys, and go ahead and hit that subscribe button as well as that bell button so that you can stick around with us and get notifications that I post almost daily on my channel. I'll see you in the next video. Bye-bye.